on. Hello, good morning. We are this morning at the American Cancer Society. I am Trevor Crow-Molyneux, of course, sitting with my dear friend Jill Fitzberg, and we're delighted to be here. We have a really cool show teed up for you guys. So I'm going to move up a little bit because I feel like we're really far away from this table, you guys. So sitting next to us, we have Kit Shapiro. Kit has been a vocal and effective advocate in fighting against colon cancer. Kit's mom is the storied and brilliant Eartha Kitt, who passed away from colon cancer.
Yes, she did.
And Jill can introduce Aubrey.
And so Aubrey is with the American Cancer Society, and the American Cancer Society has an amazing chapter here in Fairfield County. They do all kinds of wonderful things. In fact, if you would just kind of mention all the services and fantastic things you do for people who live in Fairfield County.
Sure. Yeah, the American Cancer Society offers so many things. Primarily, the local programs. We have a great program called Look Good, Feel Better. We have another Road to Recovery that provides rides for cancer patients.
That is so huge.
Treatment. Yep. Yeah.
I see people all the time on Facebook, like looking through for the friends, and it's the best thing is to refer them here. Correct.
Absolutely.
To start with.
Yes, we have a 1-800 number. It's available 24/7. 1-800-ACS-2345. So anyone can utilize that to find more about our services.
That's huge.
So you are community development manager, is that right?
Yes. Yes.
Very cool. It's wonderful. So you guys have a really big event coming up.
Yes, we have a breakfast, Women Leading the Way to Wellness.
I love that.
Yeah.
I picture like women marching on, right?
Well, I think that as women, we do tend to take the role in most things in our lives. Just ask our husbands, they'll tell you. We're pretty bossy. But I think that this is a great event because it's really women supporting women instead of stabbing each other in the back, because we get a reputation of doing too much.
We don't do that, not around here.
And really taking
that now.
Because it's so important. It's the women, it's the year, the decade, the century of the woman, and we
Love
really we really need to stay on top of each other for our health, and not just worrying about our kids and our families, but to for each other, to make sure that we're staying on track as far as our checkups and getting tested and screened and all it's really, really important, and keeping each other accountable.
And I think what's so ironic is that women think, oh, I got to take care of my child or my spouse or my parent. And if they don't take care of themselves, how are they going to do that?
Right. We tend to not think about, I'll put that off.
Like,
I
put
can
the
do that
oxygen mask on first on the plane, right?
I mean, that's what. Right.
So it's almost something like
So
that.
true.
So this breakfast, Aubrey, that you have the most incredible honorees.
Yes. One of them you'll speak with today.
Yes. One of them I'm already sold. Why don't you tell us about the others?
Sure. We have Dr. Lawrence from St. Vincent's Medical Center, who you will all get to know more
See
this
just
morning.
in a few minutes.
You guys do not know how lucky you are to be here her today. I'm not kidding.
We also have Juanita James, who's the president and CEO
She's
of the Fairfield
unbelievable.
County Communities Foundation. We're really excited to have her on board. And we also have Carol Bauer, who's a local philanthropist and also the chaplain at Norwalk Hospital.
Oh, that's wonderful.
Yes,
Wonderful. I
yeah,
didn't know she did
we're
that.
thrilled.
And you have a really
have
special
that
guest,
involved.
somebody I've seen at the Westport Playhouse, actually, the honor too, who is unbelievable. If you'd like to tell.
Kelly O'Hara. So she's our keynote speaker this year. She's a Tony Award-winning singer and actress, and she's going to be speaking about her mother-in-law, who had passed away from pancreatic cancer.
Who's James Naughton's wife,
Yes,
right? That died of
yes.
pancreatic cancer. I know he's gotten really involved
It's amazing.
with that as well.
So now how do people find you, buy tickets, donate?
So we're on Facebook, Women Leading the Way, CT. We have a website. It's acswomenandwellnessct.org. Tickets are only $85. That's something that's really unique to this event. A lot of Fairfield County events have a higher ticket price. This is really accessible to anyone in Fairfield County.
And it's
It's
terrific.
great. It's a breakfast too,
Yeah.
which is
Right.
nice because it gets before the day. Doesn't interfere with anything. It doesn't, you don't have to worry about scheduling, leaving work. It's before you go to work or before you do whatever you need to do that day, and it's a really fun event.
I went last year, and I thought it was fantastic.
Yeah,
Now,
it's
what's the
fun.
date again? Remind me.
It's Wednesday, November 8th.
Wednesday,
Yeah,
November
Wednesday.
8th.
Don't
At the Inn Longshore
Wow.
in Westport, 7:30 to 9:30.
It's at Longshore, so it's
yeah.
convenient for most
Yes.
of Fairfield County.
Yes.
It's right in the middle.
Yes, it's a compact 2-hour program. It's jam-packed with great stuff.
You're going to get Kelly to sing.
Hopefully.
But
I
not
don't know.
voice.
We'll see. We'll see. But
Her
that would be
voice
great.
So, Kit, maybe for just a couple minutes, because actually in my family, we've got a family member fighting colon cancer right now. So maybe just a couple words for families, viewers out there who are thinking, worried, taking action.
Well, my biggest thing about talking about colon cancer is that, our colons are not as sexy as our breasts. And so, to talk about bathroom humor and all that, unless you're a 12-year-old boy, you're probably not doing it. Having had 12-year-old boys, I know how that works. But colon cancer is a cancer that's not, my mother passed from it. She'd never had a colonoscopy. And that's just...
And how old was she when she...
She was 80 when she was diagnosed.
Oh, my.
And it's just, it's an unnecessary cancer to die from. I mean, not that we should, say that, you should die from this one or not, but it really is, it's treatable, it's preventable. Colonoscopies they get a bad rap. They're not, they're not.
Get them.
Just get them. It's,
it's not fun.
It's not, but it's not that, you're asleep.
Yeah.
It's a nice nap.
Well, the
Some people say
preparation's
it's like
a
an
little
amazing,
difficult.
amazing nap,
Yeah.
and you wake up and then you just are,
Yeah,
you have like a nice day at home resting.
And in a colonoscopy, if they, God forbid, should find something, they take right then and there, they remove it. And so it's really, really an important thing. Everybody should be talking to their loved ones, talking to your family members, your friends, your parents, uncles, aunts, because it's a really, really easy, test to get, and it's not necessary to develop colon cancer, if you stay on top of your treatment.
And now is it still 50 that it's recommended
50.
for the first?
It is
and then
50.
how often? I've heard so many different
Every
things
5
about that.
years, right?
Every 5 years,
Every
if there's
5 years, yeah.
If there's something.
I mean, my mother, if there's nothing, it's every 5 years, I believe. But I go I think I have every 3 years now. Because of because of my history. Although my mother was 80 when she was diagnosed, so it's not like it was early. But the unfortunate thing is that now younger and younger, are being diagnosed with colon
I was
cancer.
reading about that
And
recently.
so, if you have any type of symptoms, you need to bring it up to your doctor.
Yeah.
Do not,
Talk about it.
yeah, make sure you talk about it.
Cindy Melkerson, one of our viewers, hi Cindy, how you doing? Is saying she loves this topic, which is self-care, and you're right. This is today. Actually, the theme is really taking responsibility, and even bringing friends and family into that sort of place of keeping each other accountable. So yeah, we love that.
Yeah.
Well,
So
thank you
important.
so
You've been
much
so
for talking
terrific
to
at
us.
it, and
Yeah.
you are also
Thank
terrific
you,
at it
Aubrey.
here because you
Yeah.
are bringing, again, taking control, and that's what this whole breakfast and the speakers. That's the theme of the whole breakfast. So it's
Definitely,
very
yes.
upbeat, but it's
Yeah.
very motivating, and it's
Positive.
a great way to start your day. And like I was saying, don't go spend $15 on your green juice. Go spend $85 and give to the American Cancer Society, because also the money from this event will help people in your area get rides and get help.
Absolutely, yeah. And one of the unique things about this event specifically is our Hands Up for Hope portion of the morning. All of the money raised during that section stays local to Fairfield County. So these could be your neighbors. These could be people who don't have access to, certain programs that they would normally have. So it's a great way to make a local impact as well.
And I don't think people realize that how effective the American Cancer Society is in the local areas. That it's not just about research and the big picture that we hear about. It's really helping individuals with the everyday tasks that they have to do when they're trying to deal with the disease.
Which can be, it can seem insurmountable without
Right,
this
yes,
help.
just
And
getting
not everybody
a ride,
has like
exactly.
10 girlfriends who have nothing to do that day, who are full-time working, who
Exactly.
can help you with all these
Right.
things. It's enormous. So
And thanks
thank
to Rich
you.
Cardinal. Rich is saying that his grandfather passed away from colon cancer. My father did also, so I get the screenings every 5 years myself. So thank you so much for being with us.
Oh,
Really
my pleasure.
appreciate
Thank you.
you
Thanks
sharing
for
all this
coming in.
information.
And can we give
Yeah.
a shout out to our producer, John Branley of the Cancer
love
Society.
you.
We love John.
He deserves a lot of credit
He
for
does.
doing so many great things for people in the area.
Coordinating and keeping this all going. So thank you so much, and we have a special guest now. This is our celebrity.
Certainly a celebrity.
Yeah,
today.
come sit. This is Dr. Camelia Lawrence. I'm moving back here.
No, she's not a supermodel. Although she could be. She's actually a phenomenal breast surgeon at St. Vincent's, who's done so many things, and there's so much that we have to talk about with her, and we love your questions too. But I think what we want to start with is the screening and the importance of screening and this van that you have. So would you tell us about, not you have, but St. Vincent's has a van.
Yeah,
that
well, it's
offers that.
St. Vincent's, we are on the cutting edge of really developing a comprehensive breast cancer program. And our mobile mammography service allows us to get out into the community, into those pockets. We go to different community sites, we go to corporate sites, and really encourage women to get screened. Until we've identified a cure for breast cancer, our biggest ammunition at this juncture is finding it early when it's so small and it's curable. So our mobile mammography unit helps us to get out and accomplish that goal.
So how does that work? Does a company request that you come, or do you say like on certain dates we're in certain towns, and how can people find this?
Yeah. So we have, it's on our website, St. Vincent's.
We're going to have to print these all later.
Yeah.
John's going to
We'll
make
have
a nice
lots of
list for us, because this is big, important information.
Yeah, I mean, the phone number to reach directly is 475-210-5505, and that will take you directly to our mobile mammography coordinator, Ms. Sandra Reyes, who has a long-standing reputation in the community, and she works with these community groups, corporate site, to pick a date and time that we can bring the bus in and screen women during that geography.
So your corporation can get in touch.
Absolutely.
Yeah, this is great. So there's a lot of means to do this. Again, and Cindy Milkerson is now saying she just got her mammogram yesterday.
So
Yeah.
did I.
Which
Not
Jill
to
did
try
too.
to suck up to Dr. Lawrence. It was scheduled. I thought she'd think that, but it was scheduled.
No.
Huge.
Yeah, well, that's excellent. That's what we want, is to encourage women to focus on taking care of yourself. Be proactive. And you mentioned earlier in the show that we tend to focus on taking care of others, whether it's our spouse or children. But if we don't take care of ourselves, it will be very difficult for us to care for those who we love.
So Jill came up with a really cool idea. I think could be really helpful.
With Dr. Lawrence.
With Dr.
But
Lawrence.
made by Aubrey. I can take no credit.
This is really good. But this is such a great idea, which is go get or keep each other on top of getting your mammograms. So if you pair up, get a buddy. So what are we calling it?
So we're calling it #MyBosomBuddy. It's going to be
Love
our
this.
hashtag line. We're hoping to make this, very huge, but it could be buddies as well, because what you were talking about is maybe the most effective way to help treat breast cancer is to make sure you go every year for your screenings, which you should talk about for what it is that you need to go for.
We'll pair up with a friend. So make sure your friend goes. Make sure, check in with your friend and say, did you go? Or let's kind of set up our schedules together. Maybe even go to lunch afterwards. So really make it an effort as a pair, or maybe a few girls together.
No, absolutely. I strongly believe in the importance of having an accountability partner, so to speak. I oftentimes see patients who come in and they have not had a mammogram in maybe 5 years or 3 years, or they've missed the last 2 years. And now they're diagnosed with breast cancer. It's a little bit larger than potentially could have been caught initially. And their family or their girlfriend just said, I had no idea you didn't get your mammogram done. Now they're here at this juncture to help to provide the emotional support that's needed, and that's commendable. But imagine if you were able to intervene earlier and say, hey, let's go for a mammogram, let's go for a spa after. Make it a commitment where you're both accountable to each other. Let's get this done annually.
So, what are your thoughts on self-exam, breast exam?
So the current evidence-based data suggests that self-breast exam does not improve overall survival. However, I still encourage my patients to do self-breast exam. And the reason I do is that I think that a woman who examines her breast is going to know the landscape of her breast the best, and more likely to detect any changes, whether it's a lump, a dimpling, skin thickening, or any changes, and may be able to bring that to her provider's attention. So I still tell women, get to know your body. It's your body.
So if you examine yourself and make an appointment every year, though, once you reach the age that it's suggested, which is now 45 years old, correct? For mammogram and ultrasound. And we are suggesting that every October 1st be the day that you check in with #MyBosomBuddy, but I'm thinking not just MyBosomBuddy, maybe you have a text group on your phone.
Oh, absolutely.
And maybe you're all going to go out for dinner when you do this, and maybe you're all helping keep each other healthier and safer by doing this, and seeing if the person, your friend, not only gets her mammogram, but perhaps the ultrasound too. So
yeah. So go ahead.
Well, I had a question about breast implants. So is it harder, is it more difficult to get an exam? Do you need something on top of a regular mammogram? What would a woman do with that?
So if you have an implant, the standard recommendations are the same, which would be a screening mammogram annually. The implant does not limit your ability to get your routine screening mammogram. I think what you're hinting to is the indications for ultrasound. Ultrasound is indicated in women who have dense breast. There is a state law here for us in Connecticut that women who are considered to have dense breast should have an ultrasound added as an adjunct to their screening mammogram.
And sometimes you have dense breasts and then you don't have dense breasts later,
Well,
correct?
the density of your breast is fluctuated with age. When you think about the term density, our breast, the dense portion of our breast is the milk glands, the milk duct, and the supportive tissue of the breast, and that shows up as white on your mammogram, versus the fatty tissue, which shows up as black. So the concern with density is that cancer in the breast shows up as white. So women who have a heterogeneously dense breast, it makes it harder for the radiologist to read the mammogram with a high confidence that there's absolutely nothing there. So what the ultrasound does is add an additional modality for you to look through diligently that breast tissue and make sure there aren't any abnormalities that are hidden and not found on your mammogram.
So you can ask your doctor to have this ultrasound, or this has to be?
It's usually recommended by the radiologist. So let's say you go in for your initial mammogram and you're told that you have dense breast. The radiologist he or she will do their due diligence and say, we recommend an ultrasound in addition to your mammogram. But then going forward, if you know that you have dense breast, chances are your provider is going to order a combined mammo and ultrasound.
Now, I have another question. If in case you were to get a mastectomy, you mentioned a new procedure that you could keep the nipple, which is one of the big problems a lot of women have with the thought of going through that procedure.
Yeah. So there's several advances in surgery. One of the ones that I am quite fascinated with is nipple-sparing mastectomy. And the reason being is that you often see women who have a lot of fear about mastectomy because they're concerned about feeling mutilated, not feeling feminine after the surgery itself. What nipple-sparing mastectomy does, it allows you to preserve the nipple. So the breast has its natural contour and anatomical landmark, and it's reconstructed. You're really just saving the envelope, but you're scooping out all the breast tissue. So the woman can be in a bikini, you can be on the beach.
Beautiful.
No one knows that you've had a mastectomy other than you know, if you choose to divulge the information. You don't have the sensitivity as you would if you had your normal breast. But it's a pioneering technique. I think eventually will emerge as standard of care.
Is it done in a lot of hospitals already?
It is. It is. We do.
I hadn't heard that.
And
I
you
know
do
people
that.
I do.
So
It was an integral part of my training in Santa Monica with Dr. Juliana. Yeah.
So that is a really important thing to know. Now, what do you think of Angelina Jolie's decision to have a double mastectomy, have her ovaries taken out? She had the BRCA gene, is that what it is?
The BRCA gene, yeah.
And her mom died of ovarian
Her mom
cancer.
died of ovarian cancer. So the majority of breast cancer that we see are what we considered as sporadic. We don't know exactly what the cause is. But about 10% of breast cancer that we see in the United States are due to hereditary factors. The two most common that we hear about in the news is the BRCA1 and 2. It's in fact, it's now after Angelina Jolie came out and spoke, we talk about the Jolie effect. But women who have this mutation, you're at an increased risk of breast and ovarian cancer. And I often tell my patients, it's not a matter of will you get the breast cancers, when will it happen? And I think this knowledge translates into vigilance, because there are things that you can do to reduce your risk. And that's exactly what she did. She's a mom, she's got a couple kids, she wants to be around for them for a very long time. Her mother succumbed to the disease, to ovarian cancer. So what she went ahead and did was she had bilateral risk-reducing mastectomy.
Wow.
She's finished with childbearing, so she had her ovaries removed.
I know two sets of sisters who did that because it was in their family before it ever came near them. So
it's a very different operation when you are doing it for risk reduction versus diagnosed cancer with all the other components of breast cancer management. Surgery is just a part of it. You're talking about chemotherapy and radiation, et cetera.
Right. So now at the same time, are you getting reconstruction and this new nipple
Oh,
thing
absolutely.
too? So everything together.
It's all done simultaneously. It's no longer two separate. The idea is for
Seems
women
better,
not to wake
way
up
better.
without any breast amount. Now, granted, there are women who have breast cancer and they do not want reconstruction. They don't feel as if they need the breast. They're not defined by the breast. So we don't do any reconstruction, but that's the woman's choice. And that's what we want to emphasize, is that the patient autonomy takes precedent, and women are allowed, they know what their options are, and they're allowed to make these informed decisions.
In fact, I went to some of you know my friend Champagne Joy that passed away. She had done this unbelievable fashion show downtown for Cancerland, which is for, you know about that. And she had breast cancer survivors modeling lingerie. Some of them had reconstruction, a lot of them didn't. They looked so amazing.
Fabulous.
They walked so proud. It was beautiful, it was sexy, it was fantastic, and I would say that you saw, and that should be really personal, but it's good to have that option, that if, especially if you're taking this kind of proactive step, that you can wake up and maybe feel a little bit more comfortable that you took it.
Yeah, and you look in the mirror, so whatever you're looking at, the idea is for you to be comfortable with that image that's reflected at you.
So
Go ahead. I have a question. Dr. Lawrence,
About
you've
100?
been in a male-dominated profession.
Oh,
What's
yeah.
it been like for you to do what you do with, you know,
I mean,
and
the
be so
environment
comfortable.
that you
Yeah.
are working in?
Yeah, and we talked about this, like, not only as a female surgeon, but a black female surgeon.
Yeah.
What
Well, I
comes
mean,
up for you, and how does
well, you know, minority women as a whole, we only account for about 1% of physicians in the entire country.
is that
So,
true?
yeah. So,
Is that changing?
Yeah, hopefully.
You know, it's changing, but probably not fast enough, if
No.
you ask me. But, you know,
Crazy.
it comes with its challenges. Being a woman in a male-dominated field, I will say there are several trailblazers that preceded me, which allowed me to be able to be here, to be a comfortable practicing surgeon. But the challenges are still there. They're daily. Well, whether it has to do with just your interaction with patients, it's not just your colleague, it's also society. I still have encounters where I walk into a room, I examine a patient, we talk about what your surgical options are, and at the end of the conversation, they ask, "Are you the surgeon? Are you going to do the procedure?" So
And how do you respond? Are you used to it by now, and you just kind of that's today's fun, interesting story, or
yeah. Well, I mean, you tend to pick your battles,
Right.
and you find ways to sort of use humor to get through it. But it's definitely there. There's certain expectations that are of male being very authoritative. You know, okay, well, he's a go-getter. He knows what he wants. If you're a woman and you have a similar characteristics, you're bossy. You're hard to work with. You're demanding.
the whole room here is must be bossy and hard to work with.
You know,
Bossy women.
Except for John.
yeah.
This is good. Make history. Right. So that's good. All right, so I wanted to discuss a little news. First of all, my favorite show is back on
Wait,
television.
we're bringing back a guest for our news
We're-
because she's such a
We're
good
bringing.
commentator.
Oh yes, we have
Bringing back kids.
Kit. Kit has to come back in because I don't know. Are you a Game of Thrones? Hello.
Well,
Okay, good.
I
Yeah,
only
lots
am
to
because
come.
my entire family is, and I have no choice. I have no choice but to be. But yes,
All
I
right.
watch.
Any
watch
viewers, if you have any questions and any thoughts on Arya Stark and well, just women in general slaying everybody and thing.
Talk about the year
I
of the
feel
woman.
like I
I
just
mean,
went
that's
to
the whole
Portugal
show.
and I'm like, what?
Well,
I know. That's who Arya Stark is?
Yeah.
I keep saying she's from Game of Thrones.
Oh yeah, she's fabulous. Yeah, but she did murder a whole family and feed them to their dad.
oh my goodness.
Yep.
Yeah.
That's why I don't.
Yeah.
I don't
Oh,
know.
I just-
Well, they do. I mean, women have eaten their young, and historically in the animal
I like
kingdom.
hamsters.
So, yes,
Yeah, no, it's hard. There's a part of me that's like, okay, I should not be encouraging and cheering on a woman who is literally killing everybody around her. But then the other side of it is like, well, the whole family did kill her family, so maybe she gets to exact revenge.
I think it's in the Bible, isn't it? It's like, an eye for an eye.
eye for an
She
eye,
took
and
it,
tooth for a
literally.
tooth.
Oh my God. Anyway, so any Game of Thrones people out there, please don't.
It was a record view, I heard.
It was?
So it's not
Wow.
losing any steam.
Sherry Leibowitz was saying good morning. She's saying thanks for the info, ladies. Thanks. And Joe Calson saying good morning. Hi, Joe.
And lots more information to come.
Yeah.
And
I learned so much
to bring
sitting there
you
just
in.
listening. I mean,
Yeah.
Dr. Lawrence is amazing,
Oh,
and I
yes.
really, and I just want to say, because when my mother was fighting colon cancer, we were at Columbia Presbyterian, and both her surgeon and oncologist were women, and I really found that to be so. Nothing against you men, but in this case.
Poor John.
But it was so,
Lone man in the
it was
room.
so interesting and so wonderful. It was a little discouraging because they were younger than I was, but we won't go there. It was just such a great thing to talk to women. You talk to them differently. I think you,
Yeah, you
especially as a
connect.
woman, and my mother obviously. It would just felt very different than dealing with men. I think that we tend to, especially even women, we tend to look at a man in this authoritative role and sort of not ask as many questions and be a little bit more meek, which is an unfortunate thing that I think we do.
Especially in this situation.
Yes,
when
and
you
this
should
is when
ask
you need
and
to be
be
taking
so
control
proactive.
and asking the questions and be, very much, patient oriented. And I think that women as nurturers, I just found that women in medicine just was a wonderful experience for us, and it just felt a little bit different having women taking the lead.
So will you join in our My Bosom Buddy?
yeah.
Yes, so
Hashtag My
the Colon
Bosom
Cancer
Buddy.
Alliance actually has they take the rear end and they turn it as if it was breast, and it's like screen this too during during colon cancer.
So you can add that in, and then you can have all kinds of groups with males and females. And again, we're hoping to sort of challenge everyone. I hope you'll bring this up at the breakfast, because by then it'll be after that. That for October 1st. Again, I think we're going to ad nauseum tell you about this, but it's so important. Do the hashtag My Bosom Buddy, and we're going to challenge local businesses to do like 2-for-1s. So you come in with your friend for lunch. We'll do 2-for-1 if you've done your mammograms. Just show something from whatever, and all kinds of places I'm sure would want to get on board with that.
Yeah, I want to see all these local businesses, Fairfield County. Come on, jump on
Come
this.
on,
Hashtag My Bosom Buddy.
Special of the spas, right?
Absolutely.
You get your mammogram and then you go for a spa day after with your girlfriends. Fabulous.
Okay, you know who you are. Our friends that have spas, run spas, restaurants, all kinds of businesses. It will be great for you. Everybody will feel loyalty to you, and there's no reason we can't make this huge for breast cancer and other cancers too.
Absolutely.
So again,
really great.
Can keep talking about it, because I feel like if there's one person out there who goes for their mammogram because we had the show this morning,
Then it's impactful.
Yes.
and people who don't have, I'll just say this one last thing, if people who don't have like time or money to do a lot of volunteer work, you might save someone's life if you just get 10 friends on your phone and say, go for your mammogram this year. So that is worth,
So true.
what do I say, how much that's worth.
Priceless.
Yeah.
It's priceless.
Should we do one more news piece just to chit chat? Because speaking of women, 3 GOP women senators just put the kibosh on the repeal
Of the Obamacare.
ACA. Yeah,
Which
So
is
it's-
totally related.
exactly. And so not only do we need more women surgeons, but we also need more women running for office, right?
We do.
Right. So we have those two things. So everybody get out there, go to school, become a senator.
Yeah.
They put the kibosh. One of them. What did one of them say? You were telling me this morning
I
about.
think she said, I don't want to hurt any Americans. She's like, I don't want to just repeal this, and there's no replace at this point. So and by the way, they said, all you guys, I think it was 13 senators, males, who got together at the GOP who were discussing how to replace it, left all the ladies out of the room, and they were like, it's not working for us.
There should be an Arya Stark. I think we need to take her to Capitol Hill.
They should serve
Get
as
rid
U.S.
of
senators.
yes.
Absolutely.
I just go right to
It
it.
kind of is Game of Thrones, anyways, out there, isn't it? So
Well, that
why
is true.
not fight
It
fire
is a
with fire?
cutthroat place on the hill.
It's gotta be. All right. Well, thank you so much for being with us this morning. We've learned a lot. Hashtag My Bosom Buddy,
Absolutely.
October 1st.
And
The
send
breath.
us your picture with
Yeah.
your bosom buddy or buddies
Yeah.
to start putting up, and start pressuring businesses to really sponsor this.
Exactly.
And the breakfast,
The
Women Leading the Way to Wellness, November 8th.
You marching.
Exactly.
November 8th.
At Longshore.
At Longshore.
At Longshore,
Longshore.
yes.
And you can get a ticket where?
On the website.
Yeah.
What's the website?
We have lots to put up later.
They'll put it all up later.
I don't know if this
Exactly.
is close enough. Women leading the way to wellness, but like I
Yes.
said, I picture everyone in this room like marching.
Well, I was there last year. It was a fabulous event.
It's a really good,
Yeah.
it is.
So
Did you wear something equally gorgeous?
Just as pleasantly equally gorgeous, so that you walk into a room and you just
well, she walked in this
striking.
morning, I was like,
You're a
Well,
good.
everybody, thank you so much for watching this morning. We are at the American Cancer Society. The sign is backwards because our camera's turned, so just, you can read backwards, right? So anyway, stay in touch. We're going to be adding a whole bunch of links onto this to share this with friends, especially. Again, we're really talking about taking responsibility for your health, but also bringing friends in and getting everybody to be accountable and go get those mammograms, everybody, and colonoscopies, right?
Yes, exactly.
and family members, mother, daughters. When I was at the mammogram yesterday, they said that a lot of times mother, daughters came Yeah,
Your
our teams
daughters,
came
yeah.
in today together, and that was pretty
Yeah.
cool.
And if your
Yeah.
daughter's not old enough, just make her aware of what you're doing.
Right.
So,
Yeah.
you know, talk about it.
Exactly. Education is empowerment.
Yes.
Yeah.
Perfect. All right, everybody, have a really great week. Take care of each other.
This is
Be
awesome.
well.
Thank you.
Thank you.